Good afternoon, everyone. Welcome to the maiden voyage for the Budget Fiduciary Committee. We know that this is the most exciting subcommittee for the commission, so that's why you hear the raucous cheering in the background. Uh, my my name is Al Roulette, and I'll say more about that, but I'm going to ask Sandra now to call roll.
I'm asking all commissioners that are joining us online to please unmute your lines and speak clearly, and make sure that keep your camera on at all times during this meeting. Thank you. Commissioner Roulette,
Here.
Commissioner Contreras,
Here.
Commissioner Bunch, Commissioner Carnevale,
Here.
Commissioner Gordon,
Here.
Commissioner Designee Pulmanu,
Present.
Commissioner Wilkes. Here. We have quorum.
Thank you, Sandra. Again, my name is Al Roulette, and it's an honor to serve as the chair of this committee. As the chair of this committee, we will work alongside every other committee and are deeply committed to our standard of transparency and public engagement. We will also appreciate your insights and your ideas and suggestions regarding our committee. As this is a maiden voyage and our first committee meeting, we also appreciate your patience today as we navigate through what I believe is a robust and important agenda. Fiscal responsibility must be the cornerstone of our efforts. Through prudent financial management, we will uphold sustainability and accountability that every person, every citizen in the state of California expects of this commission. Again, as we have established quorum, I'm going to ask Vice Chair Contreras to say a few opening remarks. I appreciate your time, appreciate all of you who have joined us virtually. Thank you so very much. Vice Chair of this committee, Contreras.
Thank you so much, Chair Roulette. I'm honored to serve as the vice chair of this committee and to join each of you in this vital work. Budgeting really isn't just about numbers, it's about values, priorities, and impact. And I look forward to the thoughtful conversations ahead and working together to make sure our dollars do the most good for the most people.
I'm going to also ask our Executive Director, Brenda, to prepare to make some remarks after I read some of the requirements of our committee per Bagley-Keene. And I'm going to read these. Please note that under Bagley-Keene Open Meeting Act, any commissioners who are participating remotely must keep their camera on at all times. And we will be asking during the course of the meeting to disclose if there are any adults over the age of 18. I'm assuming that they are not in the room. They are not in the room with commissioners who are engaged remotely now, and the nature of the relationships if that changes. Additionally, under Bagley-Keene, only items listed on the agenda may be discussed during the meeting, as the commission is required to meet a 10-day public notice period. Thank you all very much. And now I'll ask our Executive Director to make a few remarks.
Thank you so much, Chair Rowlett, and Co-Chair Contreras. Very happy to be here with you all today and on the maiden voyage of the Budget and Fiscal Committee, Advisory Committee. So I know I'm about 2 months into my new position here. I can't even say new for too much longer, but very excited to be able to launch this new structure within our commission. And I think, our goal is twofold. One is to be able to pull some of the pressure off of the full commission so we can maximize and be most efficient with our time when we have our full commission together so that we can do the work in these committees, but also really in our efforts to promote transparency and really be able to work closely with stakeholders and leveraging these committees to be able to have these forums to be able to do more detailed work than we're able to do in our full commission. So really want to thank everybody for being here today. I know we launched our Legislation and External Affairs Advisory Committee last month, and now Today we'll be launching this committee and our program advisory committee right after this meeting. So then by the end of today, all 3 committees will have formally launched. So just want to say a big thank you to all of our commissioners who have made this possible, as well as all of our CBH team members and our stakeholders who have really helped us with this work. And we're going to continue to grow. So it may not be 100% perfect today, but our goal is to continue working to refine, to make these committee meetings as efficient and effective as possible. So thank you so much.
Thank you, Brenda. I'd also like to acknowledge that it looks like Commissioner Carnevale has joined us. So thank you, Commissioner, for being here. Let's move on to item 2 on our agenda. We'll be making announcements. And I'll begin by making a few announcements. As we begin the work together today, as Brenda has said, let's be mindful of how the Commission's fiscal investments, including increased support for the Mental Health Wellness Act grant program, can shape a more equitable outcomes and underscore outcomes for the communities that we serve. Your engagement in this process is an essential part of that work, and we appreciate all of you being here this afternoon. This investment reflects our commitment to advancing behavioral health resources and is in alignment with our key priorities. Again, as I've said earlier, we will be abiding by the Bagley-Keene Open Meeting Act for these meetings. As part of our commitment for deeper public involvement and open governance, today's meeting of the Budget Fiscal Committee features an enhanced public comment section designed to promote genuine dialogue between the committee and the community. And for those community members, in the mental health community, members of the community at large who are present today, as we navigate through today's meeting, if you have suggestions that will enhance engagement, please share those with staff as we will look to potentially incorporate some of those great ideas into future meetings. The new format consequently goes beyond traditional public comment by allowing for open conversation and a space for committee members to respond, ask clarifying questions, and engage each other constructively. Always looking towards the goals of the commission, always looking at the broader interest of the communities at which we're privileged to serve, and keeping in line with the strategic objectives, which at some point may themselves be adjusted to reflect Prop 1. Whether you're here to raise a concern, share a perspective, or suggest solutions, we want you to feel heard, valued, and a part of the process. We look forward to learning from your experience and collaborating towards better outcomes for our community. Next announcement is that we're pleased to announce, and again, Brenda may want to say something, that the final state budget adopted on June 27 includes continued support for Mental Health Wellness Act grant program, for the Mental Health Wellness Act grant program. Thank you, staff. Thank you, everybody. Yeah, that's a big yes. Applause, applause. That's a win. It's a win not because we get money, but because we are committed to making investments in communities and really ascertaining what services are beneficial and what services need to be refined. That's our goal and objective, not just to get money. And yet, I also recognize that there's effort associated with demonstrating the ability, the unique skill and asset of the commission and its staff. And so again, I'll ask Brenda if she wants to make any comment at this time.
No, I think you said it perfectly, and just really, it was a couple tough month, I'd say there, but I think I really just want to express appreciation to, again, commissioners, the commission staff team, our stakeholders who rallied, the legislature. I mean, I think it was just we came close, but there's a lot of value in these funds and in the work that the commission's done in the past and will continue to do on in the future to really help serve our most vulnerable beneficiaries or members in our communities that really need these services and help. So I'm so glad that we can continue doing that as part of our mission.
Thank you, Brenda. Additionally, I think it's important to note that as we move forward today, it's important to acknowledge the significant fiscal challenges that the state of California faces, including California's $12 billion budget deficit. That, again, we have been presented as citizens with a balanced budget, but a balanced budget that's based on, again, factors associated with a deficit. We want to be mindful of that, and yet not constrained by that, because, again, in unique, challenging fiscal times, there are always opportunities. Next, in case you've missed it, we'd like to remind everyone, as Brenda said earlier, that we will be convening immediately following this meeting at 2:15. The second or third best committee, the Program Advisory Committee, depending on your perspective, because we know the Fiscal Committee is the best committee, and not that I'm competitive. They're going to be discussing innovation and the Partnership Fund, so please go to our website, click on Committees to learn more. That concludes my announcements. Are there any additional announcements by commissioners or staff?
Might I make an announcement?
Certainly.
I would not ordinarily do this, other than the fact that Vice Chair Rolette is a friend and colleague of more than 30 years, but it's come to my attention, and I wanted the commission to be aware that said Vice Chair Rolette has been named to the Behavioral Health Hall of Fame of the California Behavioral Health Association by virtue of his receipt of the Health Equity Champion Award, given annually to a policymaker or community member who champions health equity in their work, making significant contributions toward eliminating health disparities and ensuring that all individuals, regardless of their socioeconomic status, race, ethnicity, gender, geographic location, have access to the highest standard of health and health care. And I wanted to bring it to the commission's attention and personally congratulate my old friend and colleague. I think it's incredibly well deserved. So,
thank you. I think that two things come to mind. First, Dave referred to me correctly as his old friend and colleague. I have a profound respect for Dave Gorton. It transcends anything that can be expressed in the amount of time allotted for our commission meeting. That said, I'm honored. I am a true believer in health equity. I try to practice that in my professional life and also in my personal life. Much more to be said about that, but thank you very much, Dave. Thank you, everyone. I appreciate it. Are there any other announcements? With that, it's now time for agenda item 3, general, and let me, I want to pause, and I want to thank Sandra for really preparing me for this meeting. I'm telling you, Sandra, I just got back from Kenya. I'm not prepared for anything. It's been a week and I'm still jet lagged, but thank you, Sandra. I appreciate that. It's time for agenda item 3, general public comment. This time is reserved for comments on items not on the agenda. Cody, please lead us in public comment.
All right, thank you, Commissioner Rolette. If you'd like live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair or staff, and at least twice the amount of time will be given to you during the public comment period. For members of the public in the room, if you have not already, please use one of the green public comment cards located where you came in to indicate you'd like to make a comment on this item or any other agenda items. Cards can be given to staff located at the welcome table. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. Now I'll go over the public comment procedures. Once the public comment period for the agenda item starts, we will close the public comment queue, so please make requests to comment at that time. You may request to make public comment by submitting a card, clicking the raise hand icon or your computer or the app, or if you're calling in by phone, push *9. When it's your turn to comment, I will call on you to the podium or to unmute your line and announce your name or the last 3 digits of your telephone number. For virtual comments, I will insert the word last comment next to the commenter's name or number to identify the last public comment. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. We truly appreciate your understanding with this process. We'll start with in-room comments. When your name is called, go ahead and go to the podium and make your comment. I think right now we do not have any in-room comments unless anyone wants to correct me. So we will move to virtual comments, and I'm also not seeing any hands raised there. So I will throw it back to you, Commissioner.
Oh, thank you, Cody. Given that there are no public comments, we will move now to agenda item 4. Agenda item 4 is the overview of the Budget and Fiscal Advisory Committee. This agenda item aligns with the committee's purpose and scope as outlined in the charter. We will discuss this committee using a decision-making framework that this committee could use to ensure structured, transparent, and consistent approach to evaluating and prioritizing funding proposals. I want to emphasize this is a draft tool. We are presenting it in draft form intentionally because we want to welcome community input. Our goal is to ensure that stakeholders feel comfortable with the final framework and see their perspective reflected in it. Over the years, I have served on the commission. I've consistently heard from stakeholders, some who are in this room, about their desire for greater transparency in how the commission allocates funding. This is our effort, in part, in response to that feedback. We want to create a clear and thoughtful process for allocating funding that best aligns with the commission's mission, values, and strategic goals, as well as the expressed interest in Prop 1. You'll see that the draft framework that focuses on alignment, impact, and equity in the broader behavioral health landscape and the value of the commission's role and position throughout the state of California. It is designed to help us assess whether the proposed funding allocations do the following: relates directly to behavioral health or the commission's work, aligns with the strategic priorities in current system transformation, advances equity and has meaningful funding impacts, and the recommendations for the committee to determine what the next step should look like and what the outcomes associated with each of those steps. The commission has already, and forgive me, my commission and committee is getting a little blurred. The commission has already created an email address specifically for the Budget and Fiscal Committee. As such, inquiries, requests, or comments can be directed to budget@bhsoacca.gov, and that's bhsoac.ca.gov. I'd like to open up this discussion for commissioners and the public to ask questions and consider, does the framework reflect the right priorities? That's the first question. Does the framework reflect the right priorities? Is anything important missing or unclear? How can we make the tool more accessible, equitable, / better? What would help you feel more confident in using or engaging in this process, albeit while using the tool? I welcome your thoughts, your suggestions, your ideas, and your comments. I'm also pleased to welcome Norma Pate, Deputy Director of Administrative Services and Performance Management, to provide a very brief presentation on our core purpose and perhaps again reference the draft document. Please welcome Norma, and Norma, you can proceed now.
Great, thank you. Welcome, everyone, and thank you for joining us today. I know this is going to be a little bit overwhelming. Our budget is complicated, and it will take some time for us to feel comfortable with the budget, but we hope that creating this committee will get us to a place where the budget is easy to understand by all. The composition of the commission, the Budget Advisory Committee brings together a diverse group of commissioners to ensure balanced perspectives. You heard today from our chair, Al Rolette, and the commission's mental health representative, as well as Commissioner Contreras, the vice chair of the committee, contributing expertise in housing and homelessness. And not with us today is Keandrea Bunch. Commissioner Bunch is a member of the committee and a representative for a labor organization for the commission. Commissioner Carnavale, committee member and representative of small employers. And Rosalind Pulmano, who is the representative of Assembly Member John Harbidian, appointed by the Speaker of the Assembly. And Javon Wilkes, who's with us today in the room, who is the committee member representing children of a youth organization. And our Commissioner Gord, who's been with us for quite some time, and we're happy to have him here as the school superintendent. I'm the Deputy Director of the Commission for Administrative Services and Performance Management. I oversee 3 different divisions, Information Technology, Human Resources, and Administration, as well as Strategic Planning and Performance Management. The meetings for the Commission will be held in a hybrid format with in-person attendance available at the Commission headquarters. This year, meetings are scheduled for August, September, and quarterly meetings planned to start in 2026. Additional ad hoc meetings will be held as needed. And the committee follows the Bagley-Keene Act as the chair explained earlier, with agendas posted 10 days in advance. And the committee provides recommendations to the full commission, and public comment includes open dialogue with the commissioners. The Budget and Fiscal Advisory Committee monitors the commission's budget by reviewing annual documents, quarterly updates, and budget change proposals. It provides recommendations on priorities, actions, and necessary submissions to the Department of Finance or legislature. And the committee also reviews fiscal analyses of projects, contracts, and grants, and raises concerns to the commission. As the chair explained, we have a draft decision-making framework, and the committee aims to provide information or recommendations through a collaborative decision-making process that leverages members' expertise. And then the key considerations include alignment. Does the funding request directly relate to behavioral health or the commission's work? Impact or equity. Will the funding ensure equitable access to behavioral health services for marginalized or underserved groups? And then the landscape and value. Have we engaged with diverse stakeholder groups, and do the impacted communities or organizations support the funding? And then the potential outcomes. Should the committee support the funding request, or are there alternatives such as modification, further review, data collection, or additional analysis needed before the funding request should be approved? And that's the quick overview of our committee, and happy to answer any questions regarding this agenda item.
I'll open it up for commissioners to ask questions and make suggestions or even recommendations. And I know I can. I'll ask Commissioner Gordon if he has any initial comments, as he has been on the committee. I think I've been a commissioner for several years. Thank you for your commitment. And then and certainly want to make sure that commissioners online and also have an opportunity to engage. I know that Commissioner Carnavale has been very involved in making recommendations regarding the fiscal direction of the commission. So I'll start there, and I'll turn it to ask Commissioner Gordon to make some initial comments.
Thank you, Chair. I guess my major question, especially given that the funding has been restored, what sort of license does the commission have, and also this committee by extension, to really think about things that are really outside the box in terms of both partnerships, delivery systems, and I reflect on my experience with the work that's been going on to try to bring the health systems and the school systems, two huge systems, much closer together in terms of access to services, the appropriateness of services, the availability of services. I think there are lots of things that we could do to try out different approaches, but is that on the table? Because it's not entirely clear to me. How do the projects that the commission would potentially consider with this relatively limited amount of funds come before us, and who generates the ideas? How are they vetted, and how are the decisions ultimately made?
Yeah, I'm going to do, the next presentation is a little bit of a deeper dive into the Mental Health Wellness Act and the history. Currently, we have funding that's allocated through 26-27. So I think this is an opportunity for the commission to really think about what next priorities we want to set beginning in 27-28. And so I think that this tool will give us an opportunity to do better planning and thinking through how we spend these funds, and also understanding the law and the requirements of the funds and how they can be spent. Don't know if Brenda, you want to add anything, or Chair, or Sandra, even on the legal matter.
Well, one of the things that Brenda and I certainly agree on is that this committee, as I think about what Dave said, again, and this is organic, so here we go, that this committee can make recommendations to the Program Advisory Committee and tell them, and even maybe direct them, to consider specific, and I won't use the language that you used because I don't recall it perfectly, but specific ideas and suggestions related to innovation and then funding those ideas. And then having the program committee really identifying for them, this is the expectation that we have, this is what we'd like you to explore, and then come back to us with some suggestions, and we'll look at the fiscal elements associated with those suggestions. I think that that is very appropriate for the committee, and I think that also it's that the fiscal committee, again, that's why I said this is the best committee. We get to direct the other ledge committee as well in terms of specific action that we feel needs to be taken. And I think that that is well within the parameters of this committee.
Maybe it's more like working together, like all the, it is on, it should be on? Yep, it's on, good, thank you. Sorry, am I not close enough? Sorry, thanks, Sandra. Yeah, so having the committees work together, and we're kind of still feeling our way out as we're launching all of these committees, but we can see, you know, organically what does come up during the commission meetings. We have to stick to agendas for sure, but we can also think about space, dedicating space in the committee meetings to talk about that, but then also, you know, from those conversations that could happen in the committee meetings, thinking about other committees that can weigh in, or you'd want to have a look at things as well. And it goes both ways, because those committees will also probably also be sending stuff this way too. So, and we'll just kind of see how it works out. And I don't know, Sandra, in terms of, you know, the logistics piece of it from a BK, Bagley Keene, or Roberts?
From
standpoint?
Bagley Keene perspective, everyone just has to keep in mind that all our committees are subject to the 10-day agenda notice requirement. So should you want something agendized on the next program advisory or, whatever referral to other committees, just keep in mind that Bagley Keene has very strict public notice rules, so it might delay a meeting or would have to be put on the next one if, we're not meeting the day subject. But Brenda was correct. You can cross-refer materials, that goes both ways between all three committees. And to the extent that we add more committees, they all can cross-refer.
And as Brenda has identified, it is within the role of the chair and I assume the vice chair of the committee that if there are specific suggestions or ideas, given the parameters associated with the Bagley Keene and just understanding what the rules are, we operate within the Bagley Keene parameters. But those ideas can certainly and should certainly be given to Chris or I, and even for the public to utilize the email address that has been identified, because we certainly expect that there may be members of the public that will have suggestions that have fiscal implications and that they'll want to send that to us. And we'll just want to make sure that we get it agendized properly and vetted properly per Bagley Keene. Commissioner Carnevale.
Thank you, Chair Roulette. I just wanted to make a couple of brief comments. Number one, I'm thrilled to see this committee. I think I was the first one that recommended early on that we have these committee structures when we realized the Prop 1 was going to expand the commission further, which I think was ultimately good because it added more expert capabilities and more important topics that we needed to pursue more seriously. But we need this committee, I think, to really go deeper with budgets than we've had time to at the meetings. At the same time, I wanted to say that I think that we should be, this is to riff off Commissioner Gordon's comment, we should absolutely be thinking about new sources of funding. I've been working closely with our new executive director and with the consultant to start to think more expansively about that, and we'll hear about that in future committee or commission meetings. But I think we have a history as a commission of advocating for additional funding sources beyond the ones that were automatically given, and especially in the context that Prop 1 is restructuring the way we have our relationship with the counties and the money that we've historically been flowing to the counties and then authorizing no longer will be a requirement. So I think it gives us a big opportunity to be the catalyst that we're designed to be, to ask for more funding where the system needs it. And we know it needs a lot of it. It needs a lot more than we have. And the intersection of school and school-based mental health is a great example, and one I happen to be talking to the governor a lot about. So I think we have a great opportunity for this committee to think creatively and include the public in that thought process. Thank you.
Commissioner Contreras.
Thank you, Chair Roulette. I have a question and then a suggestion. It's about the decision-making framework. So one, I think you may have said this already, so I'm sorry if I missed it, but is this framework the same framework that will exist for the other two committees? Yeah, it's one and the same. Okay, that's
Yeah.
helpful.
Very similar.
My suggestion is, the second bullet point under alignment is really to anchor us in the implementation of the BHSA and behavioral health transformation at the state level. And I'm just wondering if there is an ability, and this may already exist, but a supplemental document that really speaks to what that looks like or what that is. Like what are the changes to BHSA and what are we really hoping for in terms of the implementation? Because I think that can serve as a big anchor for both the committee, and the public. because I know that that's a change, right, for the committee to like really look at BHSA and the implementation. And I think that level of documentation could be helpful in future spaces.
Yes, we can absolutely do that. We have information and I can definitely include that.
Thank you.
And as staff has let me know that there is something that that we might be able to build off of and be part of our next meeting in terms of an item for a review. So that's a great suggestion. Were there other comments from other commissioners, either in the room or online? Okay. If there are no other comments, we will now we will now move to public comment. I will ask Cody to please go ahead and open up to public comment and open dialogue. Cody, you'll moderate this section for us.
Yeah, thank you. I'm just going to reread some of these procedures just in case anyone missed them. At this time, members of the public may request to make a public comment on agenda item 4 by clicking the raise hand button on your computer or the app, or if calling in by phone, by pushing *9. If you are in person, please make sure you have turned in your public comment card to the staff front table. We'll begin with in-room comments. When your name is called, please proceed to the podium and make your comment. Chair, we currently only have one in-room public comment. Stacy Hiramoto, please go ahead.
Stacy, let me say thank you for being here. You greeted us all, and I was busy looking at information. So hello, I wasn't ignoring you, and please.
Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition, and I just want to congratulate you all. This committee structure is fabulous. I think it's going to really change and improve everything at the commission and this first meeting. So we'll see which is the best committee, Commissioner Rolette, but Chair Rolette. But anyway, this is just, and this is the first committee, so I know you may get to this. I don't want to jump the gun. I was actually looking more at the program committee, so I don't know if you went over this. But I'm very glad that the Budget and Fiscal Advisory Committee, it says here that you will review the annual budget. You went over all of that, but it does also have contracts. And I hope that there will be some discussion, not necessarily today, but on contracts, because just speaking for myself as a stakeholder, but I think other community stakeholders, we're quite concerned, prior to this, like last year and years prior, to contracts that were executed that we were not, or the commission, I don't even think was made aware of. And I know that there's a rule, Sandra, that it's like if it's over 100,000, under a certain amount, you don't have to. And I get that. We don't need to know all those little ones, but I hope that this committee, there will be some place, because again, we were made aware that there are many contracts that seem to have been for large sums of money, multiple millions of dollars, that sometimes we were not aware and we were very unclear what the purpose. But again, it's a new day, but I'm hoping that this committee will be the one, if not the others, but this committee seems like, fiscal, since it's fiscal, might be one. So again, not necessarily today, but hopefully in the future, since I do see it's here. Thank you.
I want to assure the public and thank you again, Stacy, for being here. This is the last time I'll say this today, for being here for the BEST committee meeting. We are very committed to a process that includes an evaluation and review of contracts, albeit publicly. What that will look like and how that will ultimately happen will be informed by the public and by individual commissioners on this committee, you can anticipate and expect that there will be items on the agenda that will speak to that. Again, wanting to make sure that that comment is acknowledged and clearly has been acknowledged previously as a concern, and we want to be responsive to that.
All
Back to
right.
you, Cody.
Thank you. I'm not seeing any online hands raised at this time, so I'll give it back to you to continue the meeting.
All right, seeing that there are no other commissioner or public comments or questions, I'd like to ask Sandra to take a roll call vote to recommend that the committee utilize the decision-making framework to consider fiscal decisions. Please note that our committee is advisory in nature, so per Bagley-Keene, we cannot take action, so this vote is not a motion. It is a symbolic agreement that we collectively support using this decision-making framework. That said, I also assume, and Sandra, you can correct me if I'm wrong, that if commissioners have other suggestions and ideas, they can make them at later points.
100%. So this is a document that will be, if the committee votes in favor of it, can be adopted now, but can absolutely be amended at any time.
Now that public comment has closed, I will entertain a recommendation, albeit a motion, for this committee to vote on the document.
Motion.
All right.
Thank you. We have a first. Do we have a second?
Holmano, second.
Thank you. Got it. So now that we're entertaining the motion of the Budget and Fiscal Advisory Committee recommending to adopt the Budget and Fiscal Advisory Committee framework. We have a first and a second. Commissioner Rolette.
Aye.
Commissioner Contreras.
Aye.
Commissioner Bunch. Commissioner Carnevale.
Aye.
Commissioner Gordon.
Aye.
Commissioner Designee Pulmano.
Aye.
Commissioner Wilks.
Aye.
Motion passes.
Thank you, everyone, and appreciate your feedback. Looking forward to future committee meetings and utilization of the tool. That said, we will now move to agenda item 5, update on mental health wellness fund budget adjustments. Again, Governor Newsom has reaffirmed his commitment to the Mental Health Wellness Act by maintaining $20 million in the annual funding for the commission. The commission has leveraged these funds to enhance behavioral health services, including empath programs, full-service partnerships, support for older adults and children 0 to 5, substance use disorder programs, and soon peer respite services. However, proposed budget revisions for the 2025 threaten to reduce funding for these programs, potentially jeopardizing progress in serving vulnerable populations. I want to thank again our stakeholders for advocating to sustain the Mental Health Wellness Act programs, helping to avoid exacerbating health disparities and workforce impacts in the most vulnerable communities. Given the preservation of these funds, it's imperative to prioritize access to essential behavioral health services and ensure equitable support for all communities. At this time, I would welcome Norma to provide a more detailed overview. Everyone lean in. This is a lean in moment, okay? This is a committee, so I get to be a bit extemporaneous. This is your lean in moment. Lean in as Norma provides a very detailed presentation on the Mental Health Wellness Act grant program.
Thank you, Chair. Yeah, thank you. And just really wanted to make sure over the years, that I've been with the commission, which is like 15 now, I've heard from commissioners that you're interested in learning, and members of the public, that you'd like to better understand our portfolio and the work that we do, daily. And so thought that it'd be best to take a deep dive into the initiatives that we fund and also share with you some of the challenges with these grants that we've had over the years. There's been, these are, often one-time grant funds for organizations and counties. And just want to make sure that we are taking the opportunity to discuss the lessons learned from these programs as we move forward. The Mental Health Services Act grant program is one of the Commission's initiatives, and it was established under Senate Bill 82 in 2013. This is the initiative is aimed at expanding crisis services for individuals experiencing mental health emergencies. And this initiative focuses on improving access to care, reducing hospitalization, unnecessary law enforcement, and ensuring individuals receive appropriate support. Since its inception, the program has evolved through legislative updates. SB 833 in 2016 expanded the program to include children and youth, while Senate Bill 184 in 2022 introduced key updates to enhance flexibility, foster partnerships, and prioritize proactive and innovative approaches to care. Originally, the Commission received $32 million annually for the grant program and allocated $128 million to 24 counties to expand crisis services through community behavioral health programs. The results of round one were during the initial phase of the grant program, more than 70,000 instances of mental health services were provided to individuals in need. As a result of the program, more individuals were able to access mental health services, improving overall availability and reach of care. And the program increased the use of peer support during crisis interventions, with peers providing valuable assistance and guidance to individuals in need. The program helped decrease the number of hospital admissions for psychiatric cases and worked to reduce the stigma associated with mental health crisis. The program enhanced the collaboration between different service providers and improved the overall well-being and satisfaction of individuals receiving mental health services. The challenges for round one, the program experienced delays at the start due to counties not having established agreements with their partners. Additionally, forming partnerships with law enforcement, health system, and hospitals provided challenging. Just one program comes to mind was Orange County. They contracted with the hospital in Orange County, and it took them over 1.5 years just to negotiate the agreement between the hospital and the county. And so their program was delayed significantly. It's no fault of the county, but just the process that it takes to get those agreements underway. Counties also, with round one, it was a really quick process. The legislature wanted the money to get out fast. We didn't have time to think through the program. As far as the evaluation, each county developed their own evaluation method, which led to inconsistent data collection and hindering the ability to assess the program's overall impact. Counties faced challenges determining eligibility for Medi-Cal services and addressing billing issues. And less than 16% of the total grants were allocated to children's crisis services. The law at the time was not clear if funding could be used for children, and counties believed that they could only provide the services through the grants for adults. And so due to this, and also due to the statewide shortage of mental health professionals, county experienced hiring difficulties and high turnover. Crisis services don't happen from 8 to 5, and oftentimes it was really difficult to find workers that wanted to work, late nights and throughout the night to really provide these services. And then the next legislative change was Senate Bill 833. It expanded the program to include children and youth, covering crisis intervention services for individuals aged 21 and under. It authorized training for parents and caregivers with an additional $3 million in funding, evenly split between youth services and caregiver training. And the Commission allocated $40 million for children and youth ages 0 to 21, $30 million for adults and transition age youth, and $10 million for statewide evaluation. Funding categories included adults and transitioned youth, TAY, and youth ages 0 to 21, and also, this is when we started our school-county collaboratives. The challenges for round 2. In 2018, budget cuts reduced the program's annual funding from $32 million to $20 million, resulting in an 8-month delay and a 38% reduction in schools served. Decreased staffed hours for crisis intervention and case management, and lower mobile treatment capacity, which caused slower response times and diminished the quality of care. The second round of triage grants faced significant challenges due to COVID pandemic, including delays in hiring, staff engagement issue, and safety concerns. The commission contracted with UCLA and UC Davis for a statewide evaluation. However, data access and HIPAA compliance challenges caused delays. To address these issues, the contract was adjusted to focus on formative evaluation, while the commission will oversee the summative evaluation outcomes. And then information regarding the midpoint progress of on the formative process evaluation is available currently on our website. And the complete evaluation for round 2 triage grants will be released later this year. The next slide is SB 184, which SB 184 enhanced the Investment in Mental Health Wellness Act by streamlining contracting, allowing sole source contracts for grants when in the best public interest, expanding eligibility, including local agencies, community organizations, healthcare providers, and more, broader grant uses, funding crisis response, prevention and early intervention, and related strategies, innovative funding, supporting education, training, and evidence-based practices, matching funds requiring to ensure equitable access, and these updates aim to strengthen the grant program through flexibility, partnership, and innovation. The Commission adopted 6 priorities, and we currently have multiple programs in various stages of development. The Commission dedicated $20 million to each project, and we currently have 4 procurements completed and 3 procurements are planned. Next slide. The 4 grant programs that are currently active include empath units. These programs are located near emergency department in a hospital. The empath unit provides a peaceful and supportive environment. It's designed for individuals in crisis to receive prompt behavioral health care in a calming atmosphere, helping them avoid prolonged ER stays or unnecessary hospitalization. Also, the Pearls and AgeWise for older adult programs are there to help. They teach about managing depression, encouraging independence, and support both mental and physical health, helping seniors live well and stay self-sufficient. And then also maternal behavioral health and children 0 to 5, which is one of our initiatives that we just allocated, and thankfully we were able to maintain our funding, or else these programs would not have been funded. And so with the ongoing $20 million allocation, we were able to fund this program that supports families and young children to get special attention. Programs focus on social and emotional well-being of kids ages 0 to 5, helping identify challenges early and connecting families to services that fit their cultural needs. We also have a substance use disorder pilot program that the goal is to make medication-assisted treatment more accessible, reduce costs, and follow the highest standards of care, and breaking down the barriers to treatment for substance use disorder programs. The 3 procurements that are currently in process include full service partnership, technical assistance. There's 2 different projects for the FSP. The FSPs offer recovery-focused services and provide support to build stronger, more effective care systems. It's known as the Whatever It Takes program to help individuals dealing with serious behavioral health challenges. 2 separate procurements are underway for technical assistance and capacity building. And we also have our Peer Respite. Peer Respite is a voluntary short-term program that provides support to individuals in crisis. It is staffed by people who have experienced similar challenges, offering understanding and care. Currently, listening sessions and visits to peer respite programs are being conducted to better understand community needs and address them effectively before the procurement process begins. And the next slide is a chart that illustrates the distribution of the mental health wellness funding from fiscal years 2021 through 2027. Currently, an annual allocation of $20 million is dedicated through fiscal year 26-27, and planning for future funding allocations will need to begin early 2026 to prepare for the next investment. And now I will turn it back over to the chair to answer any questions you may have.
I'd like to ask commissioners to offer comments or ask questions of Norma. Again, this is a very important part of our overall portfolio. Yes.
So the new allocation of $20 million is not otherwise spoken for in terms of where it is to be directed?
So, we have, Cody, can you bring up the chart again, please, to show? We have, based on the direction from the commission, we have 6 priorities, and those priorities, each of the 6 priorities have dedicated $20 million, and those funds will take us through 26-27. So beginning 27-28 is when the next $20 million will become available for decisions to be made on how we invest those funds. But
So each of these current programs is promised X number of additional years of funding?
no, it's 20 million one-time funds, but they're allocated over multiple fiscal years. And so we have the fundings, the program started in 21-22, and the funding will continue through 26-27.
If I may, Dave, let me ask a question I think is in alignment with what you're asking. If the 20 million would have been eliminated from our budget, you referenced it, what would have been the impact of that?
The impact of that would have been that we would not have been able to fund our maternal behavioral health Children 0 to 5 grant program or the FSP or peer support services.
Effective.
You mean at all, or for subsequent years that?
Yeah, one of them would be they would be partially funded. So the 0 to 5 would have been partially funded, but we would not have had enough funds for the FSP or the peer certification.
So then to Commissioner Carnevale's point, for the next couple of years, absent finding some other funding sources, we have nothing to disperse. Is that correct? Other than what, as you say, has already been committed to.
For the Mental Health Wellness Act, correct. It's encumbered. As soon as the RFPs are completed for FSP and peer certification, the funding will have been allocated and encumbered through 26-27. Meaning that the next decision on Mental Health Wellness Act funding would begin, we would begin to have those conversations in 2026 to prepare for 27-28.
To prepare for the hope of
27-28.
of there being
Correct.
New funding. So doesn't, in a way, doesn't that raise the ante of what Commissioner Carnevale is talking about? Because if there is to be further outreach for innovation. I mean, the only thing that I remember in recent memory that came through was the report that we did on the school-based behavioral health grants, which have now ended, and there's nothing new going out. But in the report we put together, we had some very clear comments on some action that could be taken to continue that set of funding in various different ways. So are there other ideas for things that are already in play that could be launched? I don't know, Commissioner Carnevale.
Yeah, I would just say, Commissioner Gordon, there is the $100 million of innovation money that begins flowing in starting 2026 that is not allocated. We haven't decided what to do with that money. So that is one example of a pot of money that is available for us to think about for discretionary purposes. And I would hope there would be others that we find along the way. But your point is well taken.
Yeah, and I didn't include the IPF in the, because we're talking about the 24, 25, and 25, 20, or in 25, 26 budget years. And the IPF funds do not become available until 2026, 27.
Right.
And so that will be a new funding allocation for the commission that, that we'll be discussing later today at the PAC meeting. But I didn't include those funds today because we don't have those funds yet, so, in our budget.
Yeah, right, but that's something we should be thinking about,
Absolutely,
yeah, across all the committees.
correct.
Well, I think that organically what that reflects is a request to make sure that it's on the fiscal committee's radar. And so acknowledged. And then I think that it gets to, if I appreciate Dave's point, that I won't call it discretionary funding, but additional funding that comes in that's other than mental health wellness is the $100 million of innovation funding that is going to be coming through the commission. And Dave wanted to make sure that that got articulated and we began to talk about that in advance, which is consistent with Commissioner Carnevale's question about those funds. And so, is that correct?
Yes.
Okay. All right.
I'd like to ask, across all funding years, is it 16% of youth utilization?
I would have to come back to you with the numbers on the youth. I don't have all of the contracts, but we plan to do a deeper dive into the contracts at future meetings to better understand how the funds are allocated.
Beautiful.
I don't think, Lauren, you don't have those numbers? No, okay, yeah, sorry. But I can get back to you on that, definitely. And bring that back to the next committee meeting.
And then moving forward from 27, 28, especially when the innovation funds come in, there will be new program line items, correct?
Correct.
And within the past line items, will there be, like, how do we know that, one, the results and the work really transform communities? Is there reports on each of those segments?
There's evaluations for each of our initiatives, yes. There'll be
Okay.
evaluations. And that was the one that I mentioned for the Mental Health Wellness Act grant for the round 2 that's, ending. That information is on our website currently, and I can send you that information or post it in the Budget Committee email. And then we're waiting for the final evaluation for that work also.
Okay, so those programs could potentially be funded in the future or kind of go back to that line item, correct?
The current grant fund, the current?
No, like future funds. So one-time funds, like as an example, Empath. That funding stream ended in what, 20,
Let me see.
or is that still going?
Still going.
Empath's still going. Let me see, let me bring up my chart here, sorry. Yes, the empath programs, they will go through, the funding is through 23, 24. And then the programs will end in 2027, I believe.
2027. And so in one of those years, there was 36 million allocated. Where did that extra 16 come from?
Okay, so the extra 16 were reappropriated funds. And so we monitor our budget, and if grantees aren't spending down their money or agreements are ended because someone can't continue a program, we're required to go back to the Department of Finance to ask for those funds to be reappropriated if we choose to spend those funds and not let them revert. And so in this case, this was from the round one triage grant programs. We had 16.4 million that was unspent. And so we received approval to reallocate those funds. And so those funds were part of that reallocation. So they increased the empath programs by 5 additional programs. So we have a total of 11 empath programs instead of 6 because of that reappropriation.
Okay, beautiful. And then last, just looking at the information and aligning, doing that cross alignment work. When I look at like the respite center and it says non-clinical support, I look at the opportunity to elevate language like the community defined evidence-based practices, or for the staff by peers, utilizing provider classes to really hopefully encourage folks to kind of work within where we're trying to go with Medi-Cal utilization for especially special populations. So thank you for all of the information and the work being done on getting us into the future and caring for people.
Sure, thank you.
Going to Commissioner Palmano has her hand up, and so I want to make sure we recognize her. But I also want to, just before we do that, Commissioner Wilkes asked a question, and it was related to outcomes associated with grantees. And again, I think I know the answer. There's a committee that will be assigned to look at grantee performance, just as we'll look at budget and budget performance, but they'll look at specific grantee performance. And then Commissioner Gordon made a very important point that it's, in order for us to effectively do our work, getting the minutes from the other committees
Not the minutes, the material.
and the material, and the materials, the discussion materials, is helpful, because, again, grantee performance probably rests in at least 2 committees, but I'll ask Brendan to speak to that, and then we'll go to Commissioner Palmano.
Yeah, so, I mean, we've got our 3 committees, which is our program committee, the budget, and the legislation and external affairs committees. I think we've got our own internal work that we're doing on our contracts and grants efforts, and so we'll think about how we can get that information that we're doing in terms of our grant monitoring and our contract monitoring performance to these different committees. So I think that's one piece of it. And then, yes, in terms of sharing information across committees, that's a great idea. And so we can make that part of our typical process, or build that into these processes so that we're cross-informing as the conversations are happening. So we'll have to think about how best to do that.
Okay. Commissioner, you have a question online?
Hi, this is Roz. Just a point of clarification for Norma. If we did not adopt the 20 million back into the budget for 25, 26, all the procurement that is outlined here on page 18, even though you procured them, they would have been canceled, correct?
That's correct.
Okay, so for the 26th, 27th, even though the legislature has not appropriated it, the plan is to procure it for FSP and peer respite in this, again, in this table data for 26, 27. That's right, right?
Yes, that's correct.
Okay, and even though under SB 184, where the funding really for the Mental Health Wellness Act expires, is that correct?
No, it doesn't, it doesn't
It
expire.
doesn't expire. Okay, okay.
No.
But just by virtue of how this funding was created in the budget for the legislature, it has to be appropriated every budget year, correct? Just for everybody's knowledge?
Correct. It's, I mean, it's listed as ongoing funds in our budget currently, but of course, every year we risk losing funds, and we'll continue to address that as, you know.
Yeah, as we move forward. No, I just wanted to make sure that we're all on the same page as far as all our commissioner members. I think I just wanted to mention and shed light on some of the behind the scene discussions with the administration and the legislature on the Mental Health Wellness Act. There has been a confusion, not with the legislature, on the differences between the Prop 1 innovation funding and the Mental Health Wellness Act, which is why it was suggested that these 20 million ought to go away, because we're getting 20 million every year under Prop 1 moving forward for like 5 years. Okay, so I just wanted to set that in context. And so as we move forward, and as you know, I think we all would like to make sure that these funding are preserved for the commission. We ought to think about, and I know that in our discussions, there's always this integration between Mental Health Wellness Act and Proposition 1, the innovation funding, right? But we need to really be strategic, if I may say so, about making sure that, you know, the funding that we give out or award under the Mental Health Wellness Act versus the funding that we would be awarding for purposes of Prop 1, there ought to be this clear demarcation line. But I also recognize that it is not always black and white. Okay, there could be gray areas there where, hey, this touches on what we're doing in the innovation. That's why we have to do this under the Mental Health Wellness Act. We recognize that. But if we, in my humble opinion, as commissioners, we have an obligation from now moving forward that the grants that we award under this Mental Health Wellness Act and the innovation, as you all know, the innovation is also term limited, 5 years, which means that the legislature will have to evaluate whether we continue to give us 20 million under that innovation. Okay. So moving forward, we need to be strategic about the grants that we award under each of these programs and the outcomes that we expect under each of these two programs that the commission implements. Because when there is another proposal to eliminate 20 million there, 20 million here, it is very difficult to justify and say, hey, no, those are two different things, when it is not clear to us, to stakeholders, to the decision makers, the differences between the two. So it's not something that we ought to be, you know, scared about right now, but it has to be something that we ought to continue to think about as we approve grants, because it's getting harder and harder to fight for the Mental Health Wellness Act. I'll just have to admit that. Thank you.
Roz, I think your comments resonate not just with Commissioner Carnavale, who I know said yes, but all of us, and more equally as important, thank you for your sage insight into the process. I know that staff noted that. Brenda is acknowledging exactly what you said, and we need to make sure we do a better job with that in making distinct differences between Mental Health Wellness Act allocations or funding decisions and the outcomes associated with that. And then, as to borrow her language, the line of demarcation associated with innovation, the outcomes associated with that, and how we go about making that decisions. And then, equally as important, how that enhances behavioral health going forward, albeit under Prop 1. So thank you very much. So glad you're on this committee. I didn't say it. Somebody else said it for me. There's just the acknowledgement and recognition of the truth. Okay, moving right. Are there other comments from commissioners? Steve?
Thank you, Chair. Yeah, I had a quick question for Norma, but I'm compelled to just add to what Commissioner Pomano said. I was involved in the negotiation of those innovation funds with the administration, and the specific point of that funding was that it would be specifically transformative and catalytic, and it would be true innovation. And the offer was made to make it a permanent category, and we actually said no, make it for 5 years. And if we haven't demonstrated in 5 years that we have chosen well what those funds should be invested in, that will have high impact on the current mental health of the citizens of California, then we shouldn't continue to get that funding. But to your point, it was intended to be very specific and distinctive from the general funding we get, which also should be, game changing in my opinion. But they may have different levels of innovation, and I think we need to be very careful to do just that. My quick question for Norman, I apologize if I missed this, but what happened with last year? We passed the outcome-based contracting $10 million that was supposed to go out to RFP, and then I thought that was part of the MHSA funding that got canceled and then brought back on, or am I mixing the two up? What happened to that RFP?
I'm sorry, which one was that? At the 10 million?
The
you said?
outcome-based contracting effort that we passed last year to go out to bid. And there was a bid being worked on
Oh, for
throughout.
the FSP? I'm sorry, for the FSP
Maybe,
program?
is that what you're calling the FSP money?
Yeah, sorry,
Okay,
I'm
good.
sorry.
I conflated. Okay, so those are one and the same then.
Yes, that's out right now that we're developing the RFP for those. For FSP, there's two parts and the 10 million for each grant project. And so those are under development.
Well, good. And then just again for the committee there, I don't recall what the one half it was about, but the other half was specifically about creating an outcome-based contracting program that, we as a commission, I think, decided was foundationally important to trying to do this, not just for FSPs, but across everything that we do, but that we would pilot it there first. And we spent a lot of time getting to that point, and it's taken us a while, I guess, to get to the RFP, but I just want to make sure that was in there. Thank you.
Yes, it is. Thank you.
Any additional comments or questions from commissioners? All right. Seeing none or hearing none, moving on to public comment.
All right. At this time, members of the public may request to make public comment on agenda item 4 by clicking on the raise hand button on your computer or the app, or if calling in by phone, by pushing *9. If you are in person, please make sure you have turned in your public comment card to staff at the front table. We'll start with in-room comments. When your name is called, please proceed to the podium to make your comment. Chair, we currently have one in-room comment from Stacy Hiramoto.
Yeah. And just a correction, Cody, we're on item 5.
Apologies. Thank you. Item 5.
Stacy Hiramoto, RUMCO, the Racial and Ethnic Mental Health Disparities Coalition. I'm sorry for keep forgetting to say my pronouns, she, her, kanojo. I do want to acknowledge and thank Commissioner Pulmano, and it is so great that we have active and close participation with legislative staff on the commission. I just think it's so great because I know that in the past the legislators were very interested, but they just couldn't be here on those Thursdays because they had floor session. And so I'm just thrilled that Commissioner Pulmano and Commissioner Schwartz will be helping us. And that is very sobering and good for her to give us this advice. I'm just asking a question because I want to know, and again, I know it's the beginning, so maybe we don't have the answers. I didn't realize that there was a committee that will be looking at performance, unless you meant the program committee. But what I want to know is where would I ask, and again, I'm not expecting an answer today, right now, but for example, on these grants, and I know this is something that the legislature will also start looking at, how are equity issues addressed in these grants? Is there a staff person here that, looks at that? Or I know there was a committee that was sort of modeled on C-Corps, a sort of participation. But I'm willing to go look or meet with the person if that's how it's done. And I just didn't know if this is the committee or is the program committee going to be looking at that? So, when to bring up those issues. I wanted to know, for example, are grantees required to keep track of demographic information on who they serve, specifically in regards to BIPOC and LGBTQ plus communities? Are grantees required to state in their proposals how they will reduce disparities? How they will do outreach, how will they provide culturally competent services, all those kinds of things. Those are the issues that the people that I represent care about. And again, I'm not expecting an answer, but do want a little bit clarification. Is this a committee that would be talking about that, or is it the program committee? So just again, so I don't waste your time. Thank you.
Thank you, Stacy. I'm going to, again, provide a immediate response and perspective. While I don't have the charter for the program committee in front of me, certainly that falls within the realm of the program committee. And so looking at specific metrics associated with grantee performance falls well within the realm of the program committee. However, there are certainly fiscal implications associated with that, because if we, as Dave has made us aware of the importance of getting that information, it may have fiscal implications and impact fiscal or funding decisions if a particular grantee or awardee is performing amazingly. We may want to do something about that. And if they're not, we may want to do something about that. That's a bit hypothetical, but again, that's well within the parameters, I think, of the fiscal committee. And by doing something, we would make recommendations that would go back to the commission. And then I also think that there is clearly evident that our two legislative representatives on the commission have had immediate impact and added value. And so forgive me for being so familiar, but Ross, thank you for being here. Your comments are always so grounded in helping us understand the legislative realities in which this funding was birthed through. So thank you very much. Appreciate that. So I'm double downing on what you said, Stacy. You were absolutely right. And then lastly, and I emphasize this to commission members of this committee, we do want to pay attention to what the other committees are doing. We absolutely do, because a lot of what they do has fiscal implications. So Dave, thank you again for reminding us that that's part of our charter, to do the work away from just our fiscal roles, but looking at the other committees and the work they're doing and the potential fiscal implications. So thank you very much for your comments. Brenda, did you want to add anything? All right. So, Cody, back to you, sir.
There is no more public comment. Thank you.
All right. Seeing no more public comments from commissioners of the public, let's move on to the next and final agenda item. Agenda item 6. This committee marks a significant step toward fostering transparency and accountability within the commission and the commission's budget. The commission's budget highlights its role in ensuring responsible fiscal management and strategic decision-making. Transparency is not just a goal here. It's not. It is the cornerstone of the work. We are going to be responsive to our constituents, to stakeholders, to the citizens in the state of California, to the people in the state of California. Through open discussion, collaborative efforts, we aim to build trust and establish a strong foundation for the future. Your presence and participation in this part of the process is essential. Again, we look forward to what we are going to be able to accomplish by reviewing and getting a detailed overview of the commission's budget. I want to remind you of what I said. This is another opportunity to lean in. Everybody take your afternoon sort of stretch, and now let's lean in as Norma provides us with a presentation on the commission's budget. Norma.
Thank you, Chair. I know that this budget is complicated, as with any state budgets. It's difficult sometimes to understand state budgets and can be somewhat overwhelming. So I'm hoping that this presentation will give you high-level overview, knowing that in the future we plan to go deeper and make sure that we all understand the Commission's budget. Just want to start off with a quick overview of the California budget process timeline. The California budget process starts with the governor's proposal by January 10th, and the legislature reviews and revises it through hearings and negotiations. And the final budget must be approved by both houses by June 15th and signed by the governor by June 30th. The commission can request budget changes through the Department of Finance or working with the legislature to discuss new initiatives, program needs, and supports. We try to work with the Department of Finance as much as we can. So if the commission wants to request additional funds for 26-27, we have 2 due dates to keep in mind. Budget change proposals are due to finance by September 3rd, and spring finance letters are due by February 6th. Spring finance letters are a little bit different than the original budget change proposals. It's usually only addressing funding needs if there's any new proposed legislation that would require additional resources for departments. And so just want to make sure that the committee's aware of those dates. And then the next slide is the Behavioral Health Services Act, just a quick overview. Passed in 2004 as Prop 63 and now known as Prop 1. Imposes a 1% tax on incomes over $1 million to fund behavioral health services. The commission is funded entirely through a share of the state portion of the Behavioral Health Services Fund, which now is 3%. Prior to Prop 1, it was 5%, but now it's been reduced to 3%. And there's 2 different categories in the commission's budget. Operation, which includes our personnel, infrastructure, contracted services, and then local assistance is a combination of annual appropriations, and it's approximately $34.3 million for grants and contracts that are still active with the commission. The next slide is an overview of our local assistant funding. As we talked about earlier, the Mental Health Wellness Act, we receive 20 million annually to support crisis interventions and support and early intervention services. Also, funding for the Behavioral Health Student Services Act, we receive ongoing appropriation of 7.6 million to provide comprehensive school-based mental health services to students and family. And community advocacy contracts, we receive 6.7 million annually to competitive grants to organizations serving 9 specific high-needs populations. Budget directed funding sources means that the budget includes specific provisional language as to how the funds can be spent. And so we'll spend more time on that at later meeting, just so that the committee understands the rules around the funds and how we can make decisions and allocate those funds. Senate Bill 465 provided the commission with $400,000 annually to support FSP evaluation and reports to the legislature on FSP programs. And then for Proposition 1, we received $100,000 annually for 3 years, starting in fiscal year 24-25, to implement the necessary changes required by SB 326, which was part of Proposition 1. The next slide talks about encumbrance and reversion dates and braided funding, which I know braided funding means different things to different people. And braided funding for the commission means multiple fiscal years of funding, meaning that one grant could have 3 to 4 fiscal years of funding. The encumbrance represents a commitment to spend money for a future expense, and funds get encumbered when a grant, contract, or purchase order is signed. Reversion, any unspent funds will revert back to the Behavioral Health Services Fund. The majority of our budget includes funds that must be allocated or spent by June 30th each year. If not, those funds will be returned, with the exception of the Mental Health Wellness Act Fund, which has a 2-year encumbrance period, which gives us a little bit more time for planning and engaging with the community and stakeholders to make sure that we're allocating the funds to the highest needs. Some of our grants and contracts are, like I said, braided funding, which means a single grant or contract may include money from multiple fiscal years. And this method gives grantees or contractors 3 years and sometimes longer to spend the funds. And the next slide goes over our active grants and contracts. The commission currently has 188 active grants and contracts that are managed by staff that total $473.5 million. These programs will continue through fiscal year 27-28, and more will start this year. Beyond these specific local assistant appropriation, the commission has a number of contracts, grants, and studies funded from the operation budget. A more detailed list of all of our current grants and contracts is available on our website, and it provides the grantees or vendor information, total amount, and the start and end dates of the grants and contracts. The next slide goes over prior year available funds and active funds. As I mentioned earlier, staff closely monitor contracts and grants to ensure funds are spent as planned. If a program doesn't spend funds or can't meet the agreement terms, we work with the Department of Finance to extend the funds, reallocate them to other programs, or fund additional initiatives within the same category. For example, fiscal year 2024 Mental Health Services Act funds must be encumbered by June 30th, 2026, and are already allocated and approved for procurements. Older adult funds were reallocated to support the older adult grant program, approved by the commission in early 2025, and the Behavioral Health Student Services Act provides $25 million for grants for grant administration and $16.6 million for evaluation, with some grants remaining active through 2028. The next slide shows the 24-25 budget overview and the proposed 25-26 budget. The total budget for 24-25 was $48.8 million, with $14.5 million allocated for operation. Operations, we estimate spending 4.2 million, leaving a remaining balance of approximately 239,685 to cover any unanticipated costs as the fiscal year closes. We are still in the process of finalizing year-end expenses and will provide a final year 24-25 expenditure update at the September committee meeting. Additionally, 6.5 million from the Mental Health Wellness Act will be encumbered for ongoing procurements that we've discussed earlier. And this year and in the future, the commission's budget will be reduced by 3 positions and 1.5 million to meet the state operations reduction requirements. This aligns with the governor's executive order aimed at reducing state spending by 1.5 billion by permanently eliminating 10,000 vacant positions and their funding. The 25-26 budget is 447.2 million, with 12.9 million for operations and 34.3 million for local assistance. Next slide is our operations fund overview. This slide provides a bit more information on the budget allocation and current numbers we have for our operations fund, which includes personnel, operations, budget direct funds, and this year's state reductions. Usually the personnel savings covers the operations overspending, but this year most of the personnel savings were used to cover the reductions. The actuals will not be available until August, as we are still receiving some late invoices for 24-25. The next slide is an overview of our local assistance. The slide provides you with a snapshot of our ongoing local assistant funds for fiscal year 24-25. The 6.5 million of the Mental Health Wellness Act is part of the multi-year plan for Mental Health Wellness Act funds that uses braided funding. And a list of procurements starting in 24-25 and the procurements currently planned for the current year 25-26. I won't go into all the details of the local assistance spending today, but we do plan to do a more deep dive looking at our grants and contracts at the next meeting. We've also developed, it's underway, a Tableau dashboard that shows like the different buckets of money for all of our initiatives, and then it'll be an interactive document where you can click and see the contracts associated with the allocations that are going out to the communities. That's something that I'm hoping to bring to the next committee meeting and go over, more of our contracts and grants so that you better understand how these funds are allocated and to whom in the communities. And the next slide is the last, and it's a quick look at our proposed 25-26 budget. The proposed numbers are not final, as we are still working on reviewing the closed year and working with our teams on expected expenses for the current year. We will have the actuals for last year and better estimates proposed budget at our August meeting. We are not receiving any special one-time funds, so the budget does not have any significant differences from last year. The proposed 25-26 budget primarily focuses on local assistance. A comparison chart highlights fund distribution for the current fiscal year versus last year, including allocations for local assistance, personnel, operations, and budget directed. The state reduction will further decrease the commission's budget by 1.5 million to comply with the governor's executive order. And at future meetings, the commission will review our 3 ongoing grant programs, the Mental Health Wellness Act, the Behavioral Health Student Services Act, and the Community Advocacy Contracts. The programs are governed by specific provisional language regulating fund usage. The Program Advisory Committee and the Legislative and External Affairs Committee will outline fund usage, while Budget and Fiscal Committee will ensure equitable and impactful fund allocation decisions. Additionally, the Budget and Fiscal Committee will review the proposed budget and provide recommendations to maximize community impact. This is where the Budget and Fiscal Committee can leverage the proposed decision-making framework to determine how funds can be allocated effectively. By utilizing the decision-making framework, the committee can prioritize funding based on community needs, ensuring resources are directed towards programs with the greatest impact on behavioral health. And the structured approach enhances transparency and fosters accountability in fund distribution. That really concludes my budget presentation, and happy to answer any questions you might have.
Great. One of the things I might recommend for future presentations like this, if commissioners would like to ask questions at any juncture,
Okay.
the Norma is amenable to that.
Yeah, absolutely.
Okay. So for example, I had 3 questions. One related to I'm going to refer to the commission as a state agency, and I don't know if that's the correct vernacular or not, but from the public's perspective, we are. And so is the amount of the reduction that the governor mandated for the state of California and this agency commensurate with other agencies by percentage, not the amount, the percentage? Is that the same?
That's correct.
Okay, so,
So all state departments received a reduction
okay,
throughout the
same
state.
percentage across the board. That's helpful to know. And then number 2, that you referred to, I think the term you used was tableau.
Tableau, yes.
Is that going to be available to the public to see, to utilize as a tool?
And that would be a discussion we should have here in this committee, whether or not we want to make it a public availability tool on our website.
Okay, okay, it's something that I think we should consider. And then number 3, I forgot, and I'll think about it in a moment.
Sorry.
I'll remember, that's why I
You
wanted
can always
to
throw
ask.
something at me and say, hey, Norma, I
Yes.
have a question.
So I should have done that, but I didn't get the okay, so I waited
good,
and I
I'm
didn't
sorry.
write them down, but.
Happy to answer questions along the
But
way.
that, I think it would be very important to do that. And let's go in a different direction. I see 2 virtual, is it 2 virtual questions that we have? Or am I not saying that correctly here? Steve, Commissioner Carnavale, and then if there are other questions from commissioners online, then we'll go to
Yeah, I don't have a
Commissioner
question. I think
Palmano.
Commissioner Palmano does, though.
Commissioner Palmano.
Thank you. Hi, Norma. Just going back to page 25, I have 2 things I want to get some clarification. The BHSSA round 1 to 3, that's total of 255 million. I see on the grid that it looks like when it says funds available to spend under 26, 27, what does that mean? I suppose should just.
On slide 25, you said?
Yes, page 25.
The programs that we have, the grant programs that we have multiple year funding allocations. And so we've encumbered the funds for 25, 26 for these grant programs that are listed on the left.
Okay, for the BHSSA round 1 to 3, see that 2255, at least on my computer, the grid from 2020 to 2027 is blue, which means funds available to spend. Is that available to spend for the grantees and not necessarily for the commission? Did I get that right?
That's correct. These are
Okay,
funds that have
okay.
already been allocated from.
Allocated, okay, 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 okay. I picked the biggest number, so.
Okay.
And then really, I just got curious, on the operations fund. This is really on page 28. And also for the, it relates to your proposed 25, 26 budget. The staff benefits, I noticed that there was a reduction. You had a budgeted, I think in 24, 25 of over 3 million, but then the expenses turned out to be at 2.2. And there was like 1.3 something difference. Is there something going on there that, we ought to be aware? Is it like you had a natural attrition or what have you? I don't know.
For
But
the
then you
staff
budgeted, for the staff benefit. Is it healthcare? What is, I'm just curious. Yeah.
Yes, it is. It's staff benefits. And so if we don't have filled positions, then that would change. And so as we have funds that become available under salary savings, then we use those funds to fund other initiatives under the operating budget.
I see. So you had, the way I understood it is you had unfilled slots in 24, 25. Now, the staff benefits for your proposed budget for 25, 26, you have it at 3.6, which is, I suppose that's traditionally what you put in there. This is now, I'm on page 30.
Okay.
Proposed, you have 2.2 for year-to-date, 3.6 for proposed. Does that account for all the reductions at the
It does.
bottom of that grid? Okay, okay. So even with the reductions, you're proposing that the staff benefits would, you'd like to see it at 3.6. Is that how I should read that?
That's correct.
Okay, okay, thank you.
Sure, of course.
Thank you, Commissioner. Questions from commissioners in the room?
I guess my only question was, you mentioned earlier in the presentation that the budget isn't quite fine-tuned yet, isn't quite completed. And I see there's a request for us to recommend it to the full commission. Would that be more appropriate at the next meeting in September to do that? Once the budget is finalized?
Yes, I put that on there in case in case a decision was made today, just, just so we had it there. But really think that next month, when we do a deeper dive into the contracts and think through, what's included in the budget, because we're still in the, because we're just now ending the fiscal year, just ended June 30th, and it takes some time to do all this work. And so we're now preparing what we need to fund this current fiscal year, and working with the teams and Brenda, and making sure that we're allocating our funds appropriately, and we'll have that ready for you in August. But just ran out of time this month. And I just need to give a shout out to Kate, who's also on Teams, and Lauren, who's in the room, for all their hard work that goes into this. We have one budget analyst, and she does a tremendous amount of work and works late, and really powered through to get these numbers that we have today, and continuing to power through for the August meeting. So just wanted to give a shout out to Kate and thank her for all of her hard work.
Thank you. Additional comments from Commissioner Wilkes? Any comments? Okay. Any other commissioners? All right. Seeing no other commissioners, I want to move now to Cody for public comment.
Thank you. At this time, members of the public may request to make public comment by clicking the raise hand button on your computer or the app, or if calling in by phone, by pushing *9. If you're in person, please make sure you have turned in your public comment card to the staff at the front table. We will begin with in-room comments, which I don't believe we have any. And it looks like we have one virtual comment. Teresa?
Hi, I'm Teresa Comstock, the Executive Director for California Association of Local Behavioral Health Boards and Commissions. I wanted to just ask you to be sensitive to the smaller contractors. Our associations had ongoing contracts with the commission for probably over a decade. And our current contract ended June 30th. And I know that you all are just establishing these committees and new processes. But for us, it does hurt when a contract is not in place and we're not able to bill. So it won't be until probably October, November timeframe until a contract is in place, if it's approved. Your program committee will be hearing it this afternoon and considering recommending a contract for the boards and commissions. And then it will go to your, I think, meeting in September for your advisory committee. And then it will go to the commission in October to approve, and this is for a small contract. So I just wanted to just raise your awareness, and I'm hoping that this is just a glitch and that it's not going to be an ongoing problem year after year as you look to what the governor's budget is.
Thank you. What I appreciate about that comment, and my understanding, and Brenda will edit what I'm about to say if necessary or not, is that we will have an additional fiscal committee meeting in August. At that time, the fiscal committee hopefully will have gotten the information from the program, the committee that is meeting after us today. And then we will make any recommendations to the commission in August. And so I just wanted to provide you with a slightly different time frame, recognizing that that still is after what you described as ideal. I want to acknowledge that, but we'll be making a recommendation to the commission in August for the August meeting. That's our goal. Brenda? Okay. We're all in agreement. Thank you for bringing that to our attention. Back to you, Cody.
We do not have any more public comment. Thank you.
All right, as Norma has indicated, first, thank you everyone for your public comment. At this time, there will be no vote or our recommendation on this item to the full commission, as we are still waiting for the budget finalization, and we recognize and again acknowledge that that's a part of the process. And we live in California, so we are subject to the process. All right, agenda item 7, adjournment, albeit a little early. Thank you again to all commissioners for being here today, and a heartfelt thank you to members of our public. Stacy, thank you for being here, and thank you to all of those of you who are online who came to listen to our first fiscal Budget and Fiscal Advisory Committee meeting. I want to again recognize those commissioners who are part of the committee. Thank you so very much. Your input, albeit virtually or in the room, very valuable, and indeed marks what I think is an important step towards transparency and greater engagement with the community. As we are still finalizing the schedule for the year, you can expect to convene again in August and September. Everybody say, yay. You sound so excited. It's like telling my grandchildren who are visiting me from Belgium that they're going to go somewhere with me to go shopping for groceries. Yay. Please monitor our website and sign up for an email update to stay informed about upcoming meetings and opportunities to stay involved. With that, I now adjourn. And do we need to take a motion for adjournment, or can I do that? Okay. The time is 1:54 p.m. Thank you again. We are 6 minutes early. Going to give that back to you. We look forward. I am. We are the best committee. We look forward to continuing this important work together. Have a great day. And who said you can't laugh about numbers? Thank you all so very much. Take good care.
Norma, great job.
Yeah, thank you, Norma. Thank you, Sandra. Thank you.